people don't understand why, when older residents of care homes or perhaps those being cared for in their own homes, we knew that they were the vulnerable category, but their deaths are not being included in the numbers that we're seeing daily because they're not dying in hospital. Why is that the case?
Well, our measures have been designed from the start to save lives and protect the most vulnerable, including people, elderly people. I think it's fair to say that the daily briefing is using data direct from the NHS. It's accurate, it's quick, and meanwhile, the Office for National Statistics is collating on a weekly basis the registration of deaths and their reasons, which are undertaken by doctors, and that will be the principal way currently through which care home deaths can be recorded accurately.
But if a doctor is certifying a death in a care home, that information surely can get to you as quickly as a doctor certifying a death in a hospital. The concern is that we're not getting an accurate picture of the number of deaths. Care England think that, I mean, this was a few days ago, I think that an extra 1,000 deaths may have come from care homes. And actually, we're just not seeing the full picture here.
Susanna, I don't think it's necessarily the case that daily, from thousands of GPs and thousands of care homes across the country, that getting that data daily accurately is currently possible. We know that is possible from our current NHS hospital settings. The weekly reporting is done, it is transparent, and I'm sure if improvements can be made, they will continue to be made. But the thing I think the public wants is to make sure that what they hear on a daily basis is accurate. We've recognised it's not declaring what's happening in care homes on a daily basis, and I'm sure improvements will continue to be made where that is absolutely possible.
Well, OK, look, President Macron in France said to his people yesterday, were we prepared for this crisis? Not enough. Let's be honest, we lacked gowns, PPE, disinfectant gel. We weren't able to distribute enough masks. Like you've seen delays, weaknesses in our logistics. What mistakes has your government made?
Well, I think we did have a generic plan for a pandemic virus like flu. In terms of preparedness, we did have a lot of stocks. I think what's fair to say is that they were not getting distributed around the country as quickly as we would like. We also continue to procure, but also we recognise that we will need more PPE in the future, having distributed.
Okay, just to clarify, though, the question I asked you was in the spirit of Emmanuel Macron admitting to a series of errors in preparedness. What errors in preparedness are you prepared to admit on behalf of the British government? Well,
I've just flagged that I think we have a plan which is largely being well followed.
You've told me you have a plan, but the plan has left. The plan, with respect to you, Ms. Coffey, the plan can be any plan you like, but the plan has left NHS frontline workers chronically short for much of this crisis so far of the right PPE. We know it has left care workers chronically short as we speak now of the right PPE. We know that we had nowhere near. Well, let me finish. Let me finish. No, I haven't finished my question yet. We know that we had nowhere near enough testing, and now Sir Patrick Vallance, who's the Chief Scientific Officer, says that has been a problem and we need to ramp up the testing, and that's become crucial. We know that we had not enough ventilators. We were begging other countries like America for ventilators. When you say that we had a plan and you're not prepared to admit any mistakes in that plan, I say that is clearly, self-evidently, ridiculous.
Piers, as I say, we have a plan. We're conscious we have more ventilators than is currently needed. So there are some spare ventilators, but we know that we need more. That's why we opened up the ventilator strategy. It's why that ventilators are being designed and are being tested right now. But patients across the country and the public won't want ventilators that don't work. So we need to make sure that they have been tested accordingly. We don't want care workers going into care homes today.
We don't want care workers going into care homes today without the right PPE. The reason why they haven't got it, many think, many critics of the government think, and I would be one of those, is that we had such a complacent attitude to this that while other countries were locking down and preparing properly, we were sending hundreds of thousands of people out to the Cheltenham Festival, out to football matches, out to pop concerts. That's why we're so badly prepared, because we spent weeks refusing to accept the severity of this crisis.
So, Piers, coming back to the plan, as I said, we had a lot of equipment.
Your plan didn't work, did it, Ms. Coffey? You can keep telling me about your plan. Your plan singularly didn't work. That is why we still have PPE shortages. That is why we are only doing a tiny fraction of the tests we need to do. You keep just saying you had this plan. The plan didn't work, did it?
Piers, the plan is being rolled out. We are seeing the acceleration of elements like testing, the 5-pillar strategy that was there. But coming back to the original plan, there was PPE equipment. It wasn't being delivered efficiently. So we recognise that. That's why we brought in the armed forces to help with that distribution. We're now having daily deliveries around the country in a way that wasn't happening originally. So conscious that while we had aspects of equipment, it wasn't getting to the front line quickly enough.
How many NHS staff?
Why isn't PPE getting to care workers? Why isn't PPE getting to care workers in care homes? You've already said there's a differential system in terms of counting the numbers who are dying in care homes. People feel like they're being treated entirely differently in the care sector than in the NHS. We were given an example this morning that care homes, in one example, paying £8,000 a week for PPE and being charged VAT on that. Now, they say VAT is not charged when PPE is ordered into the NHS, but it is into the care sector. Why have we got a two-tier system when you keep repeating the mantra, we are trying to save lives?
So about 8 million pieces of PPE have been delivered to 26,000 care settings across the country, whether that's care homes, hospices or home care providers. Specifically on VAT,
the numbers don't matter
Susanna,
if care homes individually feel like they're not getting those pieces of equipment. And why are you charging VAT to the care sector on PPE?
So I think for the care sector, the VAT issue, to be open with you, is they can reclaim the VAT. I think in essence, they won't pay any VAT on it ultimately. So I don't think that's a particular issue.
Well, why charge them? Why charge them VAT? Why don't you just do what you've done with the NHS and remove VAT from all PPE for all care homes right now on this programme? Just do the right thing.
So VAT is not an issue when it comes to procurement of
VAT
PPE.
is an issue because we've just literally spoken 1 hour ago to the people running care homes in this country who don't understand why you're charging VAT on PPE for care homes when you've removed it from the NHS. Why?
So VAT can be reclaimed by all those care homes in their purchases, and so that's
so why bother charging it? Remove the process. They don't have time to fill in forms.
The care homes
Ms. Coffey,
that
if you're saying they're all going to get it back, remove it right now. Stop them doing unnecessary paperwork. Let them do what they're supposed to do, save lives.
The important thing, Piers, is that people can go to wholesalers, get PPE. They can also benefit from deliveries which are being made to care homes. This is all being done on clinical need. It is being distributed, and we are increasing the production, but also the testing of PPE. So whether that's businesses like Burberry's having to go through the testing process to make sure the gowns that they are committed to producing will actually be valid for use.
Do you know how many care workers have died of coronavirus or are currently seriously ill with it?
I don't know the answer to that.
Do you know how many NHS workers have died from coronavirus?
I don't have the answer to that. I know that.
How can you? I'm not being funny, but how can a member of the British government sent out to talk to the media have literally no idea how many NHS workers or care workers have died? Let me give you a bit of help. Here's the front page of today's Daily Mirror. Has the pictures of all the NHS workers who've died. Why don't you know this stuff? Matt Hancock didn't know how many NHS workers had died the other day. Why is it the journalists seem to know more than you do about how many people are dying on the front line of this?
But I do know that over 11,000 people have died, very sad deaths across the country. I do know that we are prioritising the clinical need assessments of those people, particularly in hospitals, but also in a social care setting. This has been at the forefront of the Department of Health's ministerial team from the very start. But understandably, the people who have not only have demonstrated symptoms, but continue symptoms requiring them to go to hospital has been the top priority alongside frontline clinical staff, but also social care staff can.
It's quite hard to prepare people properly if you don't, with respect, Ms. Coffey, if you don't know how many people are dying in care homes, you don't know how many health workers are dying. Quite hard to prepare and protect them properly if you have no idea of the scale of what you're dealing with. We have never seen this kind of carnage wreaking havoc on the lives of our health workers and care workers. And the least I expect is that the government knows how many of these people are dying. Shouldn't be too much to ask.
Piers, the number of deaths outside of hospitals is being registered weekly. That is being declared.
Okay, how many people have died? How many?
That continues.
All right,
the ONS will be publishing its latest update today.
How many people have died of coronavirus in care homes or at home?
Well, my understanding is that the latest figures will be issued today. I don't see the point of me doing something that's over a week old, and that information will be out later today.
So you have no idea?
My understanding is it's about 1,000. But more information will be published today. I think ONS is pulling together that data. Probably best to have accurate data portrayed to the public.
Yeah, that would be great.
And that will be circulated later today.
Yeah, we'd love accurate data. We'd love government ministers to know how many people are being killed on the front line.